Hi, I'm Cynthia Koons, a reporter at Bloomberg News. I cover mental health for Bloomberg. In some of my reporting, I've come to learn how important it is, how a CEO's views on mental health in the workplace really inform a company's culture. So I'm joined today by Chuck Robbins, the CEO of Cisco. Chuck, thanks for coming to the Equality Summit and
Well,
discussing
thanks for
this
having me.
today.
It's great to be here.
Thank you. So I wanted to talk about mental health as a form of equality in the workplace. And I wanted to start out with how you came to understand that this was a critical issue for your workforce and something that you needed to address head on rather than maybe remain in where it was in the shadows for many years up until probably the last 5 years or so. It's become a more prevalent dialogue.
Yeah, it's a great question, and it's a really important topic. So I'm glad you're covering it. It is, and it's been obviously highlighted in the last 6 to 9 months for people through this pandemic. But it all started as what I would characterize as a transactional response to some events that occurred when Kate Spade and Anthony Bourdain both committed suicide within like a week's time. And I was sitting in my office and I was just thinking to myself that I'm sure we have employees who are struggling with mental health issues. And wow, what if they watched these two suicides and decided that that's the right outcome for them? And so I walked into my head of HR, walked into her office and said exactly that. I don't want people to feel this way. So we made a decision. We crafted together an email to the company that just said, look, we recognize that people could be struggling. There are always, issues. And we highlighted all the support resources that we have and told them that we're here for you. And it was really just trying to do anything we could to just, if we could insert and influence someone who might be struggling at that moment in time. And the result of that was overwhelming. I didn't understand what we were opening up, to be honest. And the feedback and the email responses that we got to that were just incredible, with all these stories and the gratitude, stories about their children or their friends or themselves. And subsequent to that, we had employees who were willing and wanted to stand up in front of the entire company and tell their story so they could help someone else not go through whatever it was that they had gone through. And so it just magnified for me that this is a serious issue that is quite prevalent, and then from that point forward, we've built a much more, I'd say, regular communication plan. We have more updates on it. And then as we got into the pandemic, we realized that even more people are suffering, and so we implemented more things as we've gotten into that. But it was that initial situation that actually brought this to the forefront for us.
Can you talk a little bit more about that? So you mentioned the pandemic, and that created, with the physical distancing, a lot of isolation for people. And you've also had the compounded effect of the fires, adding another layer of quarantining to people who've already been isolated for some time. How have you responded to that? What are examples of maybe benefits and ways that you've reached out to your employee base and tried to keep this conversation going at a time when so many people are stuck at home?
Yeah, it is it's been interesting. And what we did when the pandemic first hit is we started a weekly video meeting with all of our employees. So we invited all 77,000 people to join us every week for an hour and 15 minutes. And early on, the topics were very related to the actual, COVID situation, the virus itself, and how to understand what was going on. So we had lots of medical personnel that were joining these calls, and we were talking a lot about that particular situation at the time. And we talked about everything from testing to, we've given updates on what we think is happening with vaccines and therapeutics all along the way. But early on, it became very clear that people who were now at home, in many cases, they were people who lived by themselves. And, the first few months, people really stayed in. And in some cities, they still are. Some people have gotten a little more flexible where you're doing a little more, but you're being cautious. But early on, people really stayed in. And so you had employees who lived by themselves that felt very isolated. You had employees who all of a sudden found themselves in very small homes without a home office, trying to work from home with 2, 3, 4 very young children at home. You have employees who had elderly parents living with them, and then the fear of somehow COVID getting to your elderly parents who are much more at risk created stress. And then just the lack of knowledge about how this thing is going to end. And when you have all those pressures and you don't know when it's going to end, it creates more mental stress, anxiety, and depression. And so we then brought mental health experts onto these calls that we were having every week. And we've gone to every 2 weeks now, but the same experts are still there for any questions that arise. And then we've subsequently hosted a number of mental health sessions for our employees. We've doubled and tripled the number of sessions that we're making available. We've put benefits in place to help our employees with childcare, with made sure they understand everything we can do for those who are treating elderly parents or dealing with that. So we've just really doubled down everything that we were doing to try to make sure that we're taking care of our employees right now. And it's a very complicated time. So.
Do you have any sense out of all of these benefits that you've rolled out, what's the most utilized at this stage? What people are really gravitating towards?
Well, I think the sessions that we've launched have been just overwhelmingly attended, and we've added more. And we've recently started a series of these check-ins for parents of children at home. And so it's really just creating forums for people to engage with experts who can just make them feel better about the situation or give them some coping mechanisms for what they're dealing with. And you don't necessarily make it go away, but if you can help people, figure out how they can deal with it more effectively. And I've told even my direct team, I said, right now during this time, you need to find your own therapy. What is your therapy right now? Because I need it. My wife needs it. Everyone needs what is it that gives you that mental break? We've told our employees, if you need to block an hour in the middle of the day to go for a walk because that's what recharges you and gives you the break you need, then do that. Block it. Take control of your time. And we really had to explain to our leadership teams that very issue is that you have employees that have small children at home, and that 3-year-old doesn't really care that you scheduled a meeting at 1:00 in the afternoon if they need their parent at 1:00 in the afternoon. And so you're going to have to be very empathetic, and you're going to have to be very flexible, and you're going to have to be willing to say, hey, let's reschedule. You take care of your child. And those kinds of things just help take the pressure off of the folks that are trying to deal with this. So there's a whole lot of those things that we've tried to do as well. And look, we're learning all along. We didn't open up the how to deal with a pandemic handbook when we started this. We've just been learning and trying to do the best we can. So.
Yeah, I can relate to that myself. I have small children at home, and they've definitely, like you said, not necessarily respected the meeting schedule all of the time.
Well, they may pop in any minute.
Well, they're not here right now, so but we have had quite a few incidents where they just try to jump in my lap in the middle of something, and so I think it's really, really good to address that head on and just say we understand what's happening here, because I think people really need to hear that. That's really actually quite critical. So in this scenario now, we have potentially months more to go of parents, say, not having childcare and having to manage work. For a company like your own, have you always been pretty flexible on hours and people work when they're able, or is this something you've kind of had to adapt to and change? Are you working off a base where people were already kind of arranging their schedule based on how they could manage their life within the realm of having normal childcare hours? Or is this something you sort of came at because March and April hit like they did and really changed the way we approached our time?
We've always had a culture of supporting, the traditional notion of work-life balance, which is obviously an interesting thing to actually discuss. But I've always told our employees, if your child has a sports event at 2:30 in the afternoon, you should go, because my belief is that after you put them to bed at night, you're probably going to be doing email at 9:30. And so, and helping think through, we need to focus on the outcomes that our employees are delivering and not how they do it or when they do it. And so this notion of taking that flexibility, we've always had that, at least culturally. And I'm not saying every leader in our company has dealt with it and supported it the way we would want them to, but that's been our overarching approach. And we had employees already working from home. But this notion of working from home with your children around in that situation is much different. I actually watched your faces. I said that a couple of times about the children. I could tell you had kids at home just by your facial reactions. I'll tell you, it was an interesting time. Early on, I have a 4-year-old granddaughter, and early on during the pandemic, she was at our house, and she opened my office door during one of our check-ins, and it just struck me at that moment. This is perfect, because I want them to see that it even happens to me. And so I actually pulled her into the video and introduced her to all of our employees so that they would know this is how it's going to be going forward. And I think that I do think this is an aspect of this pandemic that is going to stay with us. I think people are going to be a lot more understanding about what else is going on in your life when you're working from home or whatever. I can remember when we first started working from home, you would be mortified if your dog barked. It's like, and now, here we are. And so I think this is going to change how we think about it in the future as well.
Yeah, I could definitely see that. It seems like a revolution that got sped up, because I think some of these conversations were happening in some corners of corporate America and maybe not everywhere. And I think it's really accelerating right now. Now, another major event that happened in the spring were the Black Lives Matter protests and the elevation of the dialogue on systemic racism. And that's obviously also translated into a lot of companies coming out and talking about diversity in the workforce, representation, why representation matters, how to improve diversity in the diversity and inclusion in the workplace. How have you at Cisco addressed that topic within this broader topic? It is also potentially somewhat related to some of your own employees' mental health, but it's also just an important conversation topic about making sure that you're attracting and recruiting and retaining the most diverse talent you can.
Yeah, first of all, the events that have occurred and the deaths of these individuals are just abhorrent. I mean, it is, as we've said, and many of us have said in leadership roles, it is time for action. And empathy is nice, but it's time for action. And so there's an awful lot that many of the CEOs in the United States have been active in working on, whether it's police reform or whether it's your own company and how you're dealing with diversity. I will say that ironically, back in the fall of 2019, we had actually kicked off an initiative to understand better the experience of our African-American Black employees at Cisco. And we've long had a focus on gender, and I think we finally broke through and started making progress. We're not where we need to be, but we made progress, and we continue to make progress. So we wanted to apply some of those same learnings to different communities inside the company. And so the African-American and Black community was the first that we chose. And so we had a little head start, and we had a group of Black leaders inside the company who were helping inform us about their experience and what worked, what didn't work, what was good, what was bad, what needed to change, what we needed to accelerate. And we had this, I have Brian Stevenson from the Equal Justice Initiative is a good friend of mine. And if you read his book, he talks about getting proximate to the problems or the situation. And when you get proximate to something, you understand it better. And then you want to solve it, or you know how to solve things more effectively. And so we'd taken that strategy, and we actually had taken about 18 of our African-American Black employees and my entire leadership team. We met with them for about 3 hours at my house. And we had a moderator who coordinated a whole discussion around their experience. And it was so moving to hear. It was encouraging, and it was devastating at the same time to hear how they felt at different times. And many of them had been with us for 15, 20 years. And they loved the company, but they wanted certain things to change. And so we then kicked off a 100-day sprint. And so there was a lot of activity going on around that actually then that informed how we created our social justice response in the midst of everything going on in the country. And so, we're doing all the things you would expect. We're obviously trying to increase the diversity of our employee base, our leadership, our executive team, and our board. We are trying to create more talent pipeline, both internally as well as some investments that we're announcing with HBCUs, as well as we have Net Academy, which is a Cisco educational program around the world where there'll be 3 million students that will go through it this year. So a real focus on the African-American Black community. And venture capital funding that we're going to put into these kinds of spaces. And so there's a whole list of things that we as a company are trying to do. And we've had very open dialogue with our employees about where we are and what we need to do differently and what we're planning on doing. And I think that, to your point, for our African American and Black employees, on top of the pandemic, it's been an incredibly stressful time. And then, to your other point, the fires, the tropical storms, the hurricanes. I mean, this has been a heck of a year. But hopefully, we learn from this, and we never go back, and we actually make sustainable progress because we need to.
So it's interesting you came at this, you'd done this work in gender, and then you wanted to sort of take key learnings from your Black and African American leaders within the organization. What surprised you when you said you did that group meeting and you heard from people firsthand? What were the things that really stuck out that you really didn't see coming in terms of things that you really needed to do better in the workplace or in recruiting or wherever it may be?
Yeah, there were a couple things that struck me. Number one, how much they love the company, but then to hear some of their frustrations, but they were still here because they love the company. And some of the specifics were, there were people who would tell us how long they'd been in the same job grade without a promotion, right? And so we had one of the big things that was a part of that 100-day sprint was we had built a pay parity system years ago, like 4 or 5 years ago. And when we first ran it, we were running it primarily for the gender pay parity issues. And what our team realized is that it highlighted pay parity issues across also the entire spectrum of individuals. There were white males that needed adjustments because they weren't paid at the same level. What we hadn't looked at is promotion equity, right, or promotion parity. So that was one of the big things that we went and looked at, and we made a huge amount of progress, and had a much higher percentage of our African American Black employees that have been promoted in the last 6 months as a result of this. So that was one example. But I think just the things that have occurred in 2020 that have led to such a list of actions and this outrage and this focus on social justice, I think have just given us more energy. It's unfortunate, but it's given us more energy to actually continue to make progress on this. And we're having a broader discussion with our entire employee base, and I think it's been very constructive. So we have a long way to go, but we're making progress.
Well, we probably only have time for one more question, so I'd be curious what you sort of think are now best practices from the work you've been doing so far in mental health and in diversity and inclusion, things that you would want to share with other leaders if they want to even just get this conversation started or make some of the progress or start to make some of the progress that you guys are working on.
Yeah, well, look, we have a lot to learn and we have a long way to go, first of all, but I will tell you that the number one thing is don't be afraid to have the conversation, because I think that's been the issue. And when you don't understand something and you perhaps can't relate to it, it's very difficult to wade into that discussion. And so when we had an emergency company-wide meeting on like the Monday after George Floyd's death, and I had Darren Walker, who's the president of the Ford Foundation, and I had Brian Stevenson from the Equal Justice Initiative join me on that call. And I actually opened up the call by saying to our African American Black employees, look, I want to ask forgiveness from you up front for anything that we might say that is wrong, because we want to get into this conversation, but in many cases we won't know what to say. And I think just putting that out there and just diffusing it ahead of time and saying, look, we're here to achieve positive things for all of our employees. So we're going to learn together. We're going to talk about this together. And we're going to continue to make progress together. And I think you just have to be willing to get into the discussion. And when you do, when you make it okay for your employees, they will actually take over and will begin to lead you and it'll become very clear what you need to do. When the mental health thing, it was like I sent an email, but the employee response defined what we needed to do next. And the same was true when we began the conversation on the African American Black community. They actually defined our path, and now we're just executing with them on that. And I think that would be my advice to any leaders who are thinking about really taking a deeper dive into these topics and these areas that are super important for our employees and our society.